I'm Ann Barsodi with PSP Perspectives at the Trending Technology Conference in Sacramento. I am here with Jamie Mangrum. He's the Deputy Director and CIO of Department of State Hospitals. Jamie, thank you so much for joining us.
No problem. Thank you for having me.
So one of the big focus areas of the Trending Technology Conference is actionable analytics. So why don't you talk to us a little bit of how you've used analytics?
So we run a very large hospital system of forensic patients, which are patients that have been committed by court for committing some violent felony as well as being mentally ill. As a result, our environment is really dangerous. Last year alone, we had over 2,600 attacks on our staff by patients. So one of the biggest tasks that I'm given on a regular basis is to provide data and the tools basically to analytics people to figure out why that's actually happening. And so we see now every system that we deploy as a new source of information to help us peel back the onion to try to figure out why is this actually happening in our hospitals, and then how do we make our hospitals safer not only for the patients but also for our staff.
That's wonderful. So in your experience, how does this support the line of business?
Well, the line of business are basically the clinical staff that I'm taking care of. And so, as an example, in 2010, one of our staff was actually murdered at one of our hospitals. So we're constantly looking at, we'll have a spike of violence in a specific unit at a hospital, and we'll look at different sources of data to see why that's happening, and then what the staff in that unit can do to basically stop that from happening, and how do they make it actually safer.
That's wonderful. And what overall impact has analytics had that you would want to discuss or share with us?
We are seeing a downward trending on the number of attacks on patients. It's gone now substantially each year for the past 4 years. Unfortunately, our attacks on staff are keeping constant, but the decisions that we're making based on, I would say, metrics that are coming out of our analytics are helping us basically craft, I would say, clinical process and change, and then we watch it through the downstream data to see if the outcomes were basically what we were looking to achieve.
Wow, that's amazing. So is there anything else you'd like to add before we come to a close?
For us, most organizations look at data as, achieving some form of efficiency or something. For us, it basically truly is life and safety. So it's a very unique view.
Which is an absolutely wonderful perspective to hear about. Yeah.
Right.
Okay, well, Jamie, thank you so much for joining us. It's a pleasure having you, and Jamie's also a panel member here, so thank you very much.
No problem. Thank you for having me.
Thank you.